Hello, V Squad. Welcome back to another episode of VGirlTV. Welcome back, guys. Welcome back to my canal de YouTube. And as you guys can see, I am working. But of course, I had to drop by and leave you guys with this video because this is something that literally just happened to me. All right, guys. So as you guys know, I've been like super busy these days, like literally working, creating content for you guys, taking care of my kids, picking up my kids from school. It's been a lot, okay? But that is what we do, right? So as you can see, I'm in the store and this is the only place that I can actually sit down and actually produce a video for you. So I said, you know what? Why not? All right, guys. So today I had to take Gia to go get a vaccine. I usually take her to her doctor, her pediatrician, which is a private facility. But the last time when I went, which is like, I don't even know why I didn't think about this like before, but you know, when you know better, you do better, right? Whenever she would have to do her vaccines, I would take her to a pediatrician. She would get her vaccines. I would pay. At the time, I never really thought much of it, but I would always leave spending at least $200 on the visit, which included the visit, the vaccine, the vaccination, whatever other stuff that they added on there. I would always end up leaving and end up paying $200. So what I would usually do is, like, if I know that I'm going to the States for the summer, I would just have her see her pediatrician in the States, get her vaccines, and then I won't have to pay for anything because it's covered under her insurance. Now, supposedly my insurance says that they do cover certain vaccines. I have to look into it because I don't understand why I'm always having to pay like out of pocket these ridiculous prices with these vaccines. So maybe I just realized maybe I should look into that. But anyway, so this last time, you know, I haven't been to the States in a while with Gia. The last time we was in the States was literally like a year ago. And so while we was there, when we went last year, she did get vaccines. But as you know, as a child grows, there's certain vaccines that you have to take and whatever, you guys know. But for the most part, I think everyone should know because they've been vaccinated as a child, or you probably have children or nieces, nephews. So you should know more or less how this drill goes. So this last time, when I took her, when she turned 2, she was missing certain vaccines, or like not really missing the vaccine. Well, yeah, you could say certain vaccinations were missing, but it was also like reinforcement, like certain vaccines you have to do like a second dosage of it, whatever. And so the pediatrician was like, girl, like, you know, you are behind on these vaccines. And I was like, am I? I was like, the last time when I came, I seen the other, because she wasn't there, I seen another pediatrician and he told me that I just needed to do these vaccinations. And she's like, yeah, they were supposed to be done like months ago. And I'm like, oh, okay. So she's like, all right, the ones that we're going to do now, we're going to do about, I think it was like two vaccines. And then the other ones you have to come back after because we don't want to, you know, poke her up too much. And then certain vaccines have to be done within a certain amount of time from another XYZ. So I said, okay, cool. So she was like, if you go to the Centro de Salud, they're going to get on you or whatever because you were not up to date with your vaccines. Mind you, I have never assisted a public clinic before. The only time that I got a vaccination in a public facility was when I had to get the yellow fever vaccine, and I went to the one in Clayton. And I don't know why I didn't put 2 and 2 together to realize that was a public facility. But for the most part, I have never, since I've been here, I've always attended private. I have never attended a public hospital, a public clinic, to be seen, none of that. Which honestly speaking, a lot of these doctors in the private sectors do work in the public sectors as well. So it's not really a case of, oh, you know, better doctors in private facilities. That's not really always the case because, like I said, a lot of them do work in public facilities. It's more so because I don't know. I just never I don't know. And I don't really get sick like that, knock on wood, God forbid. And then if it's something really, really serious, like the last time when I had my kidney stones, I ended up going to the States because for insurance purpose, it was actually coming, it was costing me too much to actually perform the kidney stone removal here. And with my insurance in the States, it was actually, I wouldn't have to pay that much. So that is the reason why I never went to a public facility here. And I never really had to have like real major surgery outside of me giving birth. And so she was like, go to the Centro de Salud, which is the health center, which is public, and see if you could get the other vaccines. So I was like, oh, okay, so this is the doctor telling me this. She said, but for now, we're going to try to help you out with which vaccinations you're missing and the ones that we could do right now. So I said, okay, cool. By the time I left, I ended up spending like $150, okay? And I was just like, yo, this is really ridiculous. Like, why am I paying so much money in vaccinations? Like, for the life of me, I just couldn't understand. And so this go round with the ones that she's missing, I'm like, you know what? I'm going to go to the Centro de Salud, the health center, which is public. And so I have a really good friend whose mom is a nurse in the public sector. Not at that particular one that I went to, but she was the one that referred me to go to, where to go. And so I actually ended up going. And the facility, I'm not going to lie to you, it was actually very clean, okay? For it to be public and, a lot of times, when you're coming from the States or whatever, you have a lot of expectations on what you expect. Not me personally. I'm from Brooklyn, okay? If you're from Brooklyn, you know about Killer County and what Killer County was back in the day. And so I don't judge, but at the same time, I also don't want to be in a place that is not kept properly because that shows that they don't typically sanitize properly. For example, I am lying. One time I did go to a public center to get a COVID exam, and at that time this was the only place that was doing COVID exams, and that place was a mess. Like, my son was like, there were crackheads coming in. It was kind of giving like Brookdale Hospital. If you guys are from Brooklyn, you know about Brookdale. Okay. Was it Brookdale? Yeah, it was Brookdale. It was giving very much Brookdale Hospital, okay? It was giving very much like homeless people in the hallways and crackheads in the waiting area, wires hanging out the ceiling, and my son was petrified. But literally that was the only place that we could literally go to for COVID exams because we were flying out and we needed to get a COVID exam. So yes, I take that back. I did go to a public health center before, but I would say it wasn't for nothing major, okay? Got that out of the way. All right, so she told me to go to the Centro de Salud. She gave me two options to go to, and one was in Rio Abajo, and the other one that she told me to go to was in Parque Lefebvre. And so the week before, I did make an attempt to go to Parque Lefebvre to find out, what was the protocol for vaccines, getting children vaccinated, what I needed to do. But at the time, they have like a gate, so there was no one to open up the gate, and it was like traffic, and there was nowhere to park, so I ended up not going. And so I went to the one in Rio Abajo. So I go to the one in Rio Abajo, and, the lady at the front was so nice. Like, I'm not gonna lie to you, the staff was so nice, except the lady at the front desk lady. She looked like she didn't want to be there. It was evident that she did not want to be there. And so I go in, and they assume that I've been to a Centro de Salud before, okay? Which it's understandable because it's like, okay, if you're a foreigner, why would you be going to the Centro de Salud in Rio Abajo out of all places? So they were like, oh, yeah. Because I was like, can I get my daughter vaccine today? And she said, yeah, come. You have the card, the vaccination card? I said, yeah, I have everything. She said, you have her cellular? I said, yeah, I got everything. She said, okay, go get a mask. Yes, they're still wearing masks to go into the health center. So I went to go get a mask, and the young man that was selling the mask, the señor, it was an older gentleman, he didn't have change for a $20 bill. So he was like, you know what, I'm going to just give you the mask, okay? I said, okay, thank you. So he gave me the mask. We go into the to the clinic, and they're like, okay, that door, you just go right to that door and you just tell them that you want to get vaccinated. So I'm like, okay, cool. Like, this seems easy, right? Like I said, the place was super clean. The place was super clean. They had air condition. The people there were decent people. Like, there was no crackheads going in and out of the center in the waiting area like the other place. So it was cool, right? It wasn't 5-star, but it was doable because, you know, like I said, I didn't want to have to pay for the vaccine. Like, it was free. Like, vaccination, getting your kids vaccinated in Panama, if you go to the public sector, it's free 99, and your girl wanted free 99. So I was cool. We were cool. The waiting area was super clean. Like I said, I have no complaints about that. So I was waiting for the nurse to come because she was not in the office at the time. And then once the nurse came, one of the parents that was in the waiting room was like, oh, okay, that's the nurse. That's the person that you have to wait for. So, okay, cool. So I go in and I give her the card. And I'm like, okay, she's looking through it. She's like, okay, you need to get this, this, this. Mind you, I left. So the doctor at the private sector left a sticky note with which vaccines were missing and the price. And she was like, what? $50, $65? That is ridiculous. They are abusing. It is free here. It is free here. And I'm like, yeah, I know, you know, that's why I'm here. Blah, blah, blah. She was like, oh my goodness. No, 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 no. You need to get it done here. So I'm like, okay, so sweet. This nurse, I love her. Okay. And so she's like, okay, is the child registered? I'm like, no. She's like, are you from here? Because she's not understanding why my child was not registered in the Centro de Salud. And I was like, oh no. She was like, where was she being attended at? And I was like, oh, she was being attended at Punta Pacifica. And she was like, oh, okay. So she goes through the list or whatever. She goes through everything. And she's like, she's missing this, she's missing that, she's missing this. I said, okay. So she said, okay, go to the front desk. Once you go to the front desk, you're going to register her. You have all your paperwork and everything. I said, yes. She said, okay, cool. I go to the front desk. This is when I meet up with the lady at the front desk that just did not want to be there. She was not happy, honey. She was not happy. So I was like, hi, yes, I need to register my daughter. And now she looks at me like I have 10 hands. Like, okay, how is your daughter not registered in the Centro de Salud? Like, are you serious? And so I'm like, you know, try to be super sweet or whatever. So I give her my daughter's ID. I give her my cedula. I give my daughter cedula. I give her the card. She's putting in the information or whatever. Fine. After she puts in the information, I'm like, thank you. She said, okay. I'm like, okay. So I go to the other part now where I was before, back to the nurse. I'm like, okay, she's registered. So she said, okay. So she fills out the paperwork. She fills out whatever she needs to fill out. And then she tells me to wait in the waiting area, that somebody else was going to call me. Another nurse was going to call me to do the vaccine. So I'm like, wow, this is really running smoothly. Like, wow. I cannot believe that people talk so bad about healthcare in Panama. I cannot believe they talk so bad about healthcare in Panama. And so now I go into the office, okay? Clean, once again. Nurse, super sweet, right? And she's like, okay, so this vaccine we do not have, okay? There's none anywhere, okay? In none of the centers, we don't have it, okay? We do not have it. And I'm like, seriously? She was like, yeah, we don't have it. You can call back and check. She was like, this one, you actually have to wait. She said actually exactly 30 days after the first time you get it done. So she looks through the card. She's like, okay, so you got it done on this day. You actually have to wait until the 6th of April to get the next dosage. So call back or come back within, you know, you come back the 6th, the 7th, the 8th, anytime during that week to get this vaccine. But you have to call to find out if we even have it, because we don't have that either. And I was just like, okay. Okay. She said, yeah, I'm so sorry. We don't have it. And I'm just like, in my mind, I'm like, wow. So this whole time, like, I'm always hearing people complaining about they're not having any medication in the Centro de Salud. And that, you know, the reason why they don't have any medication is because there are not some people that are just really not that honest, and they take the medication, they steal it, and they sell it to other people. And so then we're here where people need medication and they don't have medication. Now, this is public knowledge, okay? So this is not me spreading hearsay or she say. This has been on the news, okay? But I personally never experienced it because I always go private. And so that was the first time that I ever was like, wow, okay, this is crazy, right? So she said, okay, so since I wasn't able to do the vaccination anyway, because it was still too early, she says, go to the front and get the phone number, call, and around the week call to find out if the vaccine came. And I was like, well, every time I call the number, which I did call the number prior to, no one answers the phone. And she was like, no, it's another number, get the number from the girl at the front desk. I said, okay, cool. I go to the front desk, the woman that was there. I'm like, hey, they told me that they didn't have the vaccine and I have to come back next week. Can I get the phone number for, to call just to double check to make sure, you guys have it? She's like, I don't have the number. I'm like, you don't have the number? She was like, no, yo no tengo número. Yo no sé el número de aquí. Yo no sé. And I was just like, okay, well, is there someone that I can talk to get the phone number maybe? She was like, well, the nurse told you to get the number. This is exactly what she said, but obviously in Spanish. She was like, the nurse, she's the one that told you to come up here and get the number. She should have the number, so tell her to give you the phone number. And then she turns to the guy next to her who was playing Candy Crush on his cell phone, and she's like, hey, do you know the phone number? And he's like, I don't know the number, while he continues to play Candy Crush. So now I call my friend now, and I'm like the one whose mom is a nurse in the Centro de Salud, but a different one. And I'm like, hey, I just came here and she told me, basically explain the situation, that they told me that they didn't have the vaccine and that I had to come back, next week anyway, because the other one, has to be done in a certain time frame and they still didn't have it anyway. So yeah, I'm like, he's like, what? He was like, no, go back to the nurse. And so now I'm on the phone with him or whatever so he can hear this, right? And I'm like, I go back to the other nurse, the first nurse. And I'm like, oh, do you have the phone number? She was like, no, I don't have the phone number. Ask the people in the front. I said, yeah, they told me to come back here and ask you. She was like, no, go in the other room and ask the other nurse for the phone number. And so I'm like, okay. But when I was going to knock on the door, I realized she was with another patient. So I was like, you know what? Just forget it. So basically, I didn't get the vaccine, didn't get the phone number, because no one knew the phone number. And yeah, they didn't have any medication. They didn't have any vaccine. So I call my friend is like, what? Are you serious? I'm like, yeah, you heard what is going on. He said, okay, I'm going to call my mom and I'm going to find out, what's going on. So he calls his mom and she's like, yeah, what? They don't have the vaccine. That is very strange. Like, how do they not have the vaccine if X and XYZ happen? And I'm just like, yeah, I don't really know, like, what is going on. So she was like, he said, okay, so she's gonna, talk to whoever she needs to talk to figure whatever needs to be figured out, because she is in disbelief, as I am in disbelief, that there is no vaccine in the Centro de Salud. So yeah, this actually puts a lot of things in perspective for me and for a lot of expats as well. Get private insurance. And if you're going to have babies here, like I did, because obviously these are things that people learn as you go, right? If you are, just don't depend on the public health facilities, okay? Am I saying that the public health centers are, terrible workers, blah, blah? No, that is not what I'm saying. But if there is a situation where you are in dire need of something, they might not have the medication. And then you would be like stuck, like, okay, like what is going on? I never really realized that because I always went private. If you're going to go to the public facilities, these are things that you are going to encounter. I personally never encountered it because the one experience the two experiences, the first time when I went to get yellow fever, I went to one in a predominantly different type of neighborhood, which is where the old army base was. So maybe if I would have went there, maybe I would have had a different experience. I don't know, because I didn't go, because I was like, ugh, I don't want to go all the way over there. It's too far. But maybe I should have gone there. Now, am I saying that public sectors are bad? No, they're not. Okay, kind of got thrown off because someone rang the bell as I was going through this. But it's just like, do I really want to be dealing with, or do you want to deal with, you going to get checked out and there's no medication, or there's not, certain things that you need? No. So I advise anyone, if you are going to come into Panama, make sure you have your health insurance. Like I always tell a lot of you, a lot of the reasons why a lot of expats leave Panama is for health reasons. And I'm just being really honest. Like, even with baby boomers or people that are retiring here, even with people retiring here, after a certain age, let's be real, like, anybody could get sick, yeah. But when you are up in age, you're going to require more medical attention. There's so many things that you're going to require, especially when it comes to health. And so, although Panama is a developing country, they're not equipped in certain aspects, in certain areas. Yes, there's hospitals like Punta Pacifica, which is affiliated with Johns Hopkins, but everyone does not have access to those type of hospitals, because a lot of those hospitals, even with insurance, they only cover a certain amount of money. They don't accept pre-existing conditions. So sometimes you might end up having to come out your pocket $2,000, $3,000 for a surgery, or even $1,000 for a surgery. You just don't know, And so in that sense, I always tell people, just be mindful of these things. Like, people are not mindful of these things. And then there are like a lot of, what do you call those, urgent care centers? And when you go to these urgent care centers, you can pay anywhere from like $5 to $20, depending on what area you are in. They'll give you a prescription, but then you'll have to go to the pharmacy to buy your medication. And, a lot of these medications are a lot cheaper than it would be in the States. But if you have health insurance in the States, then your health insurance, I'm quite sure, will cover a certain percentage of it. So it might end up coming out cheaper that way. So I'll tell anybody, just weigh your options. Like I said, I love Panama. I know people are going to be like, okay, well, because, there's always a troll like, okay, why, since you always got all this stuff to say, why are you still there? Because obviously, if I'm here for a reason, okay? I actually love it. But these are stipulations that come with it. Just like if you're in a relationship with a partner, you may love your partner, and there are things that you may not like about your partner, because we are all human beings. We are all living in an existence, and everything is not going to be perfect all the time. There are going to be things that you may not like about certain things, and such is life. So I say that to say, guys, if you're going to move here, be aware of everything. I like to tell you guys the good, the bad, the ugly, everything, okay, the truth. And so that you guys can make a great decision, a good decision based on you. Maybe you may not want to be here for 12 years. Maybe you just want to be here for a year, 2 years. It may work for you that way. Or maybe you're looking for some place to escape for the rest of your life, So these are things that I think you guys should take into considerations. Let me know, guys, if I should go into a deeper conversation about healthcare in Panama. It could actually be part of our live discussion where we can do our Q&As like we always do. Let me know in the comment section. And as always, guys, thank you for always tuning into my videos. Peace and love.